Okay, hi, my name is Alex Zambrano Lombeida, a student of Universidad Católica Santiago Guayaquil, and now we're going to talk about the rib fracture associated with Bordetella pertussis infection. The Bordetella pertussis is a gram-negative, aerobic, pathogenic, encapsulated coccobacillus of the genus Bordetella, and the causative agent of pertussis of whooping cough. The bacterium is spread by airborne droplets. Its incubation period of 9 to 10 days on average. Humans are the only known reservoir of Bordetella pertussis. Now we are going to watch a little video about the Bordetella pertussis.
Whooping cough is an acute respiratory disease that is caused by the bacterium Bordetella pertussis. Symptoms include severe coughing fits with a characteristic whooping sound followed by vomiting. Whooping cough is highly contagious. It can be spread by airborne droplets containing the bacteria, which are expelled during coughing or sneezing. The bacterial droplets can then be ingested by another person, spreading the infection. The bacteria infect the airways and damage epithelial cells. Some epithelial cells have brush-like cilia that beat in a coordinated fashion. Other epithelial cells, called goblet cells, produce mucus. The mucus forms a blanket over the tips of the cilia. It traps dust, pollen, and microbes. The cilia mechanically remove this debris by brushing it up and out of the airways. The pertussis bacteria infiltrate this barrier and attach to the cilia. The bacteria secrete toxins into the area. The toxins spread through the airways, causing the goblet cells and ciliated cells to rupture and die. The bacterial toxins also stimulate the goblet cells to release nitric oxide. This released nitric oxide also damages the cilia, causing them to break. The nitric oxide also causes extrusion, so some of the ciliated cells are forced out of the epithelium. The combination of these effects leads to significant epithelial damage and cilia with confused motion. This hinders the ability to mechanically remove mucus and debris. Mucus is not removed and builds up in the airways. The body attempts to rid itself of this buildup by causing a violent coughing fit. Bacteria containing droplets are released and may infect a new host, beginning the cycle again.
Okay, now applications in medicine. A 60-year-old woman presented to her primary care physician's office with a 2-week history of dry cough and severe pain in the right flank. 5 days before presentation, she had received a diagnosis of viral upper respiratory tract infection, but her symptoms had not abated with supportive treatment. Physical examination revealed a large acute echinosis across her right flank, and tenderness and palpitation over the chest wall on the right side. Computed tomography of the chest and abdomen revealed a displaced fracture of the lateral aspect of the ninth rib on the right side. Nasopharyngeal culture confirmed infection with Bordetella pertussis. Pertussis is associated with paroxysm of coughing, which when several can lead to complications such as rib fractures and injuries to intercostal vessels.
Whooping cough produces a bacterial infection transmitted by contact with droplets from an infected person. It is often spread to infants by infected family members. When infected, the bacteria attach to the lining of the airways in the upper respiratory system and release toxins that lead to inflammation and swelling. The disease starts with cold-like symptoms such as runny nose, low-grade fever, and mild coughing. After an incubation period of up to 14 days, patients begin to suffer from a severe cough that can last for several weeks. DTaP is a combined vaccine against diphtheria, tetanus, and pertussis. The vaccine is administered in 4 doses at 2, 4, 6, and 15 to 18 months of age. A 5th booster shot is recommended between the ages of 4 and 6.
Okay, pros. Even though the infection of Bordetella pertussis is highly contagious and it causes a dangerous disease, the treatment is very simple and extremely effective. Okay, cons. The bacteria is very contagious, spread by fecal droplets from one person to another, and the disease is really dangerous, most commonly seen in children.
Hello friends, today's topic is pertussis. Pertussis, it is also known as whooping cough or 100-day cough. It is a highly contagious bacterial disease. Initially, the symptoms are usually similar to those of the common cold with runny nose, fever and mild cough. This is followed by weeks of severe coughing fits. Causes of whooping cough or pertussis. It is caused by the bacterium Bordetella pertussis. It is an airborne disease which spreads only through the coughs and sneezes of an infected person. Now coming to signs and symptoms of pertussis. The classic symptoms of pertussis are a paroxysmal cough, inspiratory whoop, and fainting or vomiting after coughing. The cough from pertussis has been documented to cause subconjunctival hemorrhages, rib fractures, urinary incontinence, hernias, and vertebral artery dissection. Violent coughing can cause the pleura to rupture, leading to pneumothorax. Next comes mechanism of pertussis. It acts primarily via its pertussis toxins but also via invasion of tissues and alveolar macrophages. Bordetella pertussis attaches to the cilia of the respiratory epithelial cells where it produces cilia paralyzing toxins and causes inflammation of the respiratory tract, thereby interfering with the mucociliary escalator by which pulmonary secretions are cleared. Diagnosis of whooping cough. A physician's overall impression is most effective in initially making the diagnosis. Single factors are much less useful. Methods used in laboratory diagnosis include culturing of nasopharyngeal swabs on a nutrient medium, polymerase chain reaction, direct fluorescent antibody, and serological methods.
Okay, now issues apply in Ecuador. Bordetella pertussis is a common infection agent worldwide. It affects most frequently children and old-age patients. In Ecuador, it's really common this type of infection because of the environment factors such as humidity, temperature, and forest. Ideal place for the bacteria to reproduce. In conclusion, it's really important to know the signs and symptoms of this kind of bacteria so it can be properly managed clinically. And also, it's important to administer the vaccines, tetanus, diphtheria, and cellular pertussis to limit the infections and prevent it from affecting the children.
Pertussis is a contagious infection caused by the bacteria Bordetella pertussis, which causes violent coughing spells, called paroxysms, which make it difficult to breathe. When it's finally possible to breathe in, air is drawn in through partially closed, swollen airways that creates a whooping noise that gives pertussis its other name, whooping cough. Bordetella pertussis is a gram-negative coccobacilli, meaning that it looks like a short pink rod on a gram stain. It transmits from one person to another through a sneeze or cough. And when that happens, thousands of bacteria-filled droplets spray out about 2 meters, or 6 feet. These droplets can land in the mouths or noses of nearby people, or get directly inhaled into the lungs. The bacteria can also survive for several days on dry surfaces, so it's also possible to get the bacteria by touching a surface, like a contaminated doorknob, and then touching your own eyes, nose, or mouth. Bordetella pertussis releases toxins, which are proteins that help the bacteria in various ways to attach to and damage the respiratory epithelial cells. It starts with 3 toxins: filamentous hemagglutinin, pertactin, and agglutinogen, all of which help to anchor Bordetella pertussis to the epithelia where it remains during an infection. Next, there's the tracheal cytotoxin, which paralyzes the cilia, which are the little hairy projections on the epithelial cells, so that they can't sweep back and forth anymore. Normally, these cilia sweep away mucus and any bacteria stuck in the mucus, so paralyzing the cilia allows pertussis to stay snugly attached to the epithelia. This also means that mucus starts building up, which triggers a violent cough reflex to clear the airway, starting up those coughing fits. Another toxin is pertussis toxin, which also helps with anchoring pertussis to the epithelia as well. In addition to this, though, pertussis toxin causes an increase in the absolute lymphocyte level in the blood, specifically an increase in the population of T cells floating around, through a few mechanisms. First of all, pertussis toxin stimulates T cells to divide, causing them to leave the spleen and thymus and enter circulation, and it also blocks them from leaving the blood and migrating into tissues. Pertussis toxin also makes the blood vessels in the respiratory tissue more sensitive to histamine, which makes it easier for fluid to seep out of the blood vessels and into airway tissues. This makes the airways swell up, making it harder for a person to breathe, and causes the classic whooping sound during a coughing fit. Finally, there's a toxin called adenylate cyclase toxin, which blocks phagocytes from getting to the site of infection and prevents them from being able to kill the bacteria that they do manage to engulf once they arrive. As if that wasn't bad enough, the adenylate cyclase toxin even induces phagocytes to undergo apoptosis, effectively killing themselves. A pertussis infection starts with the incubation period, which is the time between the bacterium entering the body and the onset of symptoms, and it usually lasts about a week. During this time, Bordetella pertussis peaks. Even though the immune system's killing and clearing Bordetella pertussis during this phase, symptoms persist from the damage caused by the bacteria when it was alive and thriving. The most notable symptom that persists is when a person gets paroxysms that come out like a machine gun burst, an uninterrupted fit of coughing, followed by an inspiratory whooping noise which comes from air sliding past a glottis that's still partially closed and swollen. The violent force of these paroxysms can cause vomiting, a collapsed lung, broken ribs, and tiny petechiae in the face as capillaries burst from the pressure. Rather than having violent coughing fits or making a whooping noise, really young infants often have gasping, cyanosis, apnea, or can have an apparent life-threatening event, called an ALTE, during this phase. Decreased oxygen levels can cause serious problems like seizures, encephalopathy, and even death. There's also an increased risk of pneumonia caused by other pathogens that take advantage of the fact that the respiratory tract is damaged. Finally, there's the convalescent phase, which lasts between 2 to 3 weeks, during which the cough slowly improves, the paroxysms and whooping fade away, and the airway heals. It's best to diagnose pertussis during the catarrhal phase, because the antibiotics can be used to kill the bacteria and reduce damage. Some ways to identify the bacteria are by swabbing the nasopharynx and trying to grow the bacteria in a culture, or by identifying the DNA of a live or dead bacteria by polymerase chain reaction. Another option is to use a direct fluorescent antibody which detects Bordetella pertussis antigens. A final option is to look for pertussis serology, looking for an antibody response to pertussis, which is usually detectable after an infection has gone on for a few weeks. One important predictor of the severity of the illness, especially in young infants, is the degree of lymphocytosis. Fortunately, antibodies from the pertussis vaccine are a great way to avoid the disease in the first place, or lessen the symptoms if it does happen. Pertussis vaccine is most often given as a part of the DTaP vaccine, which stands for diphtheria, tetanus, and acellular pertussis. The vaccine is greater than 90% effective in protecting against pertussis. That's why pertussis outbreaks usually only happen in countries that don't have access to the vaccine, in communities with a high rate of unvaccinated individuals, and among the elderly who may have gotten the vaccine a long time ago, but now have waning levels of antibody, which can be used when bacteria are still alive and prevent pertussis transmission to other susceptible individuals, especially young infants and immunocompromised individuals. And this can be done by isolating the infected person and giving antibiotic prophylaxis to household contact.
Okay, thank you for watching this video, and that's all.
Oh, yeah.